Hello, Calvary family. As we begin the process of regathering for in-person small group worship, we had a wonderful Reimagine and Regathering Task Force that helped us with that to identify a set of safety protocols. And I am really pleased to introduce to you all Linda Wilson. Linda has been a member of Calvary for 7 or 8 years or so. She served on our task force, and in addition, Linda, you're a doctor, a medical doctor. Tell us a little bit about your medical background and experience.
Yes, I am a retired physician. I am board certified in anesthesiology and pain management subspecialization. I attended the University of Southern California and then moved to Texas because I joined the Army and was a military physician for 10 years,
wow.
Which is where I did the majority of my training. And then married a Texan, and the rest is history.
All right.
I practiced in Victoria, Texas for about 30 years, and then spent the last 2 years of my practice working part-time for an Austin pain management group here in Bastrop.
Okay.
And then retired.
Well, hey, do you see that smile when she says that? That's great. Well, congratulations on retiring. You know, I wonder, I know from my perspective, it seems like things are changing sometimes hour by hour with what we know about the coronavirus. How are you kind of keeping up to date? Is it something you're focused on as a retiree, or are you just glad to be out?
No, I'm actually quite focused on it because I belong to there's a volunteer corps of retired physicians that the Texas Medical Association has asked to re-enter the workplace in case we are needed.
Mm-hmm.
There was talk initially that the convention center in Austin would be utilized for COVID patients, and I was on the list for serving at that location.
Wow.
But thank goodness that has not materialized.
Yeah, a lot to be grateful for.
So I've been keeping pretty close track of the events, not only in Bastrop County, but in Travis County and the 5 county surrounding areas.
That's wonderful. Well, I can testify to Linda's helpfulness. Linda also serves on the school board of Calvary Episcopal School, and in both of those roles, on our Regathering Task Force and with the school board, she has just brought so much expertise and knowledge about how we can do this. So, Linda, what are your thoughts on how can we be as safe as possible as we start to gather in person?
I was talking to Father Matt about how I approach this as a physician, and everything in medicine is always says from a risk versus benefit approach. And so when you're thinking about bringing people back together in a pandemic situation where there's a lot of risk that is still unknown and still developing and still that we're learning about, you have to think in terms of things you can do that will be beneficial. Even though we don't have control of the risk, sometimes we do have control of what we can do that will be potentially beneficial, and certainly not harmful, which is the other thing that we always keep in mind. And so when you break down the concept of trying to regather and bring people together that have not been together, that we don't know their medical history necessarily, you can sort of break it down in about 4 different ways that will make it as safe as possible, always keeping in mind that there's risk, but the benefit of gathering can certainly outweigh some of those risks if we do it safely. The first category that I think the Reimagine Task Force dealt with was sanitation and hygiene. And with that, we reviewed everything from cleaning our church, our objects, minimizing sharing of materials, using appropriate EPA approved cleaning supplies, and basically sanitizers, washing your hands for 20 seconds, not touching, your eyes, not touching your mouth, trying to keep your your distance, which is kind of a separate category that we'll talk about, but just some very basic conceptual ideas about sanitation and hygiene that should be forever and utilized regardless of from an infectious disease point of view,
right.
Regardless of pandemic or
Mm-hmm.
not. Those are very good habits to get into. A second phase is prevention in our population, and making sure that we are doing our part to prevent someone else from getting ill and to keep ourselves as well as possible. So that would be categories like if you have a fever, if you have a cough, if you have chest pain, if you have some unusual physical presentation, and even now they're discovering it can be gastrointestinal symptoms, headaches, anything that is out of the ordinary. If your temperature is over 99.4, don't gather because you're going to potentially help someone else from not getting an illness.
Right.
And you may or may not have it, but there's no reason to expose someone else to that potential in the event that you do have it. So that is a very important concept. Mm-hmm. Another thing in terms of prevention is the age of our congregation. Their studies are changing constantly. More data is being input into the existing studies as to who's really at risk. And what we're finding is that above 85 is at our most extreme risk, and their risk of contracting a very serious or even a deadly form of this is 8 times higher than the general population.
8 times higher.
It's significant.
Wow. Okay.
Some studies 6%, but up to 8%. If you are of the age range of 75 to 84, then your risk is about 3.5 times higher. If you're between 65 and 74, it's about 1.5 times higher. So it starts at age 65 in terms of being at a higher risk of contracting.
That's significant.
So that would imply that until our numbers are down, our prevalence numbers are down, that our elderly parishioners either probably not gather in person, especially the 75 to 85-year-old range,
yeah. A lot of risk.
until our numbers are down even further. But they're going down, so that's the good news. And just to keep safe in terms of prevention. And I think that's a really important factor. Another element is social distancing, and that has been a surprisingly controversial subject because we're Texans and we're all very much independently inclined, but that makes a difference. They're saying 6 feet is important, and 6 feet is important because their studies are finding that the droplets can spread 6 feet, and that it is an airborne type of, primarily airborne virus, and that because the viral particles are even smaller than the flu-like viral particles, they're assuming that there's a higher infectivity rate at this point. Still not clear how much higher, but could be twice as high as just the regular influenza, which varies also depending on the strain. But so the social distancing of 6 feet is to try and minimize any spread of viral particles from person to person in community situation. Wearing masks. Initially, we got off to a slow start on that recommendation, in part because we didn't have enough, but now that that is being remedied, the recommendation has been for some time now to wear masks. And there are thoughts that just that single factor plus good hygiene have diminished the number of cases and fatalities that we've had, certainly in Texas. It's important because there's a large number of people who are asymptomatic when they first get it for up to even 8 days. in which case you may not know that you have something
Right.
that you're spreading to someone, but if you're wearing the mask, you're reducing the viral load in the air around you, so you're protecting your neighbor even more than you're protecting yourself. And that's a really important concept when we join together, in a church setting or school setting.
Of course, yeah.
I think.
Why? I know masks have been become a football, kind of a contentious issue. Why is there a sense that they're so helpful?
Because not only is it an airborne virus, it tends to linger in the air longer than some of the influenza viruses. So the mask is just another layer of protection from diminishing whatever escapes into the air, so that the viral load goes down and there's less likelihood of infection if you have less virus floating around in the air. It's another reason that things like airflow are considered important, because you're diluting the viral load that is being presented to your neighbor.
Right.
So,
Which is why we're starting outside, is because
Yes.
there's lots of free airflow in there, whereas in here it's not quite the same.
yes, and even sunlight is has been determined to reduce the
Yes.
viral load. So all of those things are things that we can do that are positive, that have been shown to have benefit.
And what happens if you've got a group of folks gathered and everybody's wearing a mask, except for maybe one or two people? What happens then in that group?
Then the problem with that is that if that person that is without the mask has an infection and doesn't recognize it at the time, they're very much at risk of spreading it to the other people in their group. And another reason I think it's so important that everyone wear a mask is that you don't know what the medical status of your neighbor is. There's higher infection rates and morbidity and mortality in people who have things like obesity, hypertension, diabetes, lung disease, asthma. And you don't know necessarily what your neighbor is dealing with in terms of their medical history and health. And so it's just another precaution that you're offering your neighbor by reducing their risk.
Masks, it sounds like they're more about protecting the people around you than protecting yourself. What an easy way to love your neighbor.
Yeah.
That seems pretty simple.
And I think it does offer some protection, but the greater level of protection comes from not spreading it if you have it.
Yeah, that's wonderful. Well, for that reason, we want to make sure that everybody understands in our safety protocols that masks are required. That's just not the decision of the vestry and the Regathering Task Force and me. It's actually a requirement from Bishop Doyle as well. And the decision that we've made is if someone were to come and try to attend one of our services and make their way into our worship space without a mask, the only option we would have if that person wouldn't leave, the only way we could really protect everyone would be to just cancel that service or stop that service wherever we were at and dismiss people. It's our top priority. We want to be able to worship in person, and I'm confident in the plan that we have, but our number one priority in this time and season is to make sure we are as safe as possible. So with that, this has been kind of a heavy conversation, thinking about all these different things. But it doesn't have to be like this. You might notice that Linda has a wonderful mask on. I don't know if there's a story behind your mask.
A friend. Yeah, friends can give friends colorful masks.
Yes, yeah, she's got lots of colors. I had a friend make this one that looks like a clergy collar for my face, so that's good. So we're actually going to be launching a Calvary Episcopal Church mask wearing contest. So what you do is super easy. Just take a selfie of yourself wearing your favorite mask, and you can email it to our new communications manager, Astrid. Her email is communications@cecbastrop.org. The contest starts tomorrow and it ends next Thursday, so there's 9 days of the contest, and we'll be posting pictures of your favorite face masks on Facebook, and then we'll have some judges get together and pick a winner, and they'll win a special thing, probably a mask, but not to let the cat out of the bag. So we invite you to be part of the mask wearing contest. We invite you to prayerfully consider and discern whether you are want to return to in-person worship or continue worshiping online. Linda, thank you for sharing your expertise and being a voice that's really balanced and wise in this, and sharing your gifts with our people. You are here for such a time as this.
Thank you.
Thank you.